advancement of digital biomarkers and the provision of remote healthcare has greatly progressed during COVID-19 global pandemic. Combining voice and speech data with artificial intelligence and machine-based learning offers a novel solution to the growing demand for telemedicine. Hello, my name is Dr. Jas Sara. I'm a cardiology fellow at Mayo Clinic, and the title of our narrative review, which will be published in Mayo Clinic Proceedings in the September 2023 edition, is Guess What We Can Hear? Novel Voice Biomarkers for the Remote Detection of Disease. In the current review, we address a number of topics. First, we describe the basis upon which digital voice biomarkers could facilitate telemedicine. Second, we discuss potential mechanisms that may explain the association between voice biomarkers and disease. Third, we offer a novel classification system to conceptualize voice biomarkers, depending upon different methods for recording and analyzing voice and speech samples. Fourth, we outline evidence demonstrating an association between voice biomarkers and a number of disease states. And five, we describe the process of developing a voice biomarker from recording and storing voice samples and extracting relevant acoustic and linguistic features to training and testing deep and machine-based learning algorithms to detect disease. We finish by exploring several important future considerations in this area of research, including the necessity for clinical trials and the importance of safeguarding data and individual privacy. Voice biomarkers offer promise in delivering healthcare remotely by providing adjunctive information that can aid healthcare providers in making decisions about the detection, progression, and treatment of disease, and could be used as a surrogate endpoint in clinical trials. The association between voice biomarkers and systemic disease could relate to disease or injury affecting the lungs, the vocal folds, or the articulators which produce phonation. Or it could relate to disease or injury affecting the brain and other neurological structures which influence phonation, or through systemic processes affecting the cardiovascular, endocrine, or immune systems. Lastly, voice biomarkers could also reflect our psychosocial states. Voice features and biomarkers are associated with a number of cardiovascular, neurological, and psychiatric diseases, and even COVID-19. The classification of voice biomarkers involves outlining the source of vocalization, the method of voice assessment, the method of voice analysis, and the location of recordings. Developing voice biomarkers involves obtaining voice recordings, performing audio pre-processing, undertaking acoustic and linguistic feature extraction and selection, carrying out the training and testing of voice algorithms, and evaluating their integration into clinical practice. And lastly, for the field of voice biomarkers to evolve, there is a need for large prospective clinical trials in demographically and linguistically diverse populations. Special attention also needs to be given in defining how to safely integrate voice biomarkers into existing clinical and research work models in a way that prioritizes data protection and individual privacy. And I'll conclude by outlining a number of studies that we have ongoing here at Mayo Clinic. To start, we do discuss previous studies that we have undertaken in the current review paper, and these include studies that have looked at the relationship between voice biomarkers and pulmonary hypertension, heart failure, and coronary artery disease. And we've now transitioned this work into the echocardiography laboratory, trying to establish if there are any associations between voice biomarkers and different types of structural heart disease shown on echo. We've also started working with our structural interventional cardiology colleagues, looking to see if there are any temporal changes in voice features after structural interventions have been performed. We'll also start working with our heart rhythm colleagues to see if there are any identifiable voice changes in individuals with atrial fibrillation who undergo ablation procedures. we're collaborating with our colleagues in anesthesiology, looking at the association of voice biomarkers with postoperative outcomes. And we are also looking at the association between outcomes in patients undergoing cardiac rehabilitation and a specific voice algorithm developed by a company in Silicon Valley, which was designed to detect depression and anxiety. And lastly, we are working with our colleagues in general internal medicine who have established a long COVID clinic, and we're looking at voice and other cardiovascular biomarkers in this population. And so there's a lot of exciting work coming through. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.